Good day, everyone. I am Andrea Liwanag, a student nurse from Davao Doctors College. And today, I'll be doing a third demonstration of Leopold's maneuver. It is systematical palpation of the abdomen for assessing the fetal position and presentation. Prior to the conduct of the procedure, I have prepared the necessary equipments needed to conserve time and energy. This includes pillow, a towel, and stethoscope. I also performed hand washing in preventing the spread of microorganisms. Now, I'm going to introduce myself to the patient, verify patient's identity, explain the procedure to the patient, and also I'm going to ensure my patient's comfort and privacy as well. Good morning, ma'am. I am Andrea Liwanag, your student nurse for today. May I see your wristband, ma'am? And please state your complete name.
Hi, Miss Andrea. I am Bea Alonzo.
Okay, ma'am. So today we'll be doing Leopold's maneuver. So what I'm going to do is to expose your abdominal area only. I'm going to palpate and feel your baby and then try to determine your baby's position inside your uterus. Will that be okay, ma'am?
Yes.
Do you have any more questions?
No.
So is it alright if we proceed with the procedure right now?
Yes.
So, okay, I'm going to close the door for you so that no one from outside will be able to disturb you while we're doing the procedure. Is that fine?
Yes.
So, mom, before we begin, I encourage you to void first that so that later during the procedure you will not feel uncomfortable, okay?
Okay.
An empty bladder promotes comfort and allows for a more productive examination. Okay, ma'am, so now you're done voiding. Please lay back down. Slightly flex your knees. Okay, and now I need you to turn your right side just a little so that I can place a towel. So I'm going to help you to turn your right side just a little. Now position the patient supine on the bed. Place one pillow under head and slightly flex the knee and place a towel beneath her hips. So these steps are done to facilitate a more accurate assessment and provide comfort for the client. Flex knees as well relieves the tension of the abdominal musculature and place one towel beneath the patient's hips so that this will prevent the uterus from compressing the large blood vessels, the interior vena cava, and the aorta when a pregnant woman is a supine position, thus preventing supine hypotensive syndrome. Next, stand at woman's side if right-handed facing the patient. Okay, mom, so now we'll begin. I am going to expose your abdominal area. Okay, I will raise your shirt. Okay, now I'm going to proceed with the first maneuver. This is called the Fandal grip. Okay, ma'am, I'll begin palpating. So if the head is palpated, it would feel hard, round, feeling movable and followable. However, if the bridge or buttocks palpated, it would feel softer and nodular. It's either the head or the buttocks is palpated at the fundus than the baby is in inverted line. However, if neither the head or the buttocks is palpated at the fundus, then the baby is most likely a transverse line. Now I'm going to proceed with the second maneuver. This is called the umbilical grip. To do this, I am going to palpate in a downward direction in both sides of the abdomen, applying a gentle but deep pressure. Okay, ma'am, I will palpate again. I'll try to determine your baby's back extremities. So, if the fetal back is palpated, then it would feel a long continuous structure. However, if fetal extremities is palpated, then it would feel nodular, reflecting the portion of the extremities. Now I'm going to proceed with the third maneuver. This is called the Leopold'S grip. To do this, I am going to use my thumb and fingers of one hand and then the lower abdomen, this cross just above the symphysis pubis to determine if the presenting part is already in cage. Okay, ma'am, so I'll palpate again. So if not engage a movable body part, it will be felt. Now I'm going to proceed with the fourth maneuver. This is called the frontal grip. This is done to determine the findings of the third maneuver and also determine the deflection of the vertex into the pelvis. To do this, I am going to face my patient feet and then palpate for the metallic prominence. So ma'am, I'll palpate again. Now, if the prominence is off at the same size as of the small parts, then the baby's head is flexed. However, if the prominence is off of the same side as of the fetal back, then the baby's head is extended. Now that I'm done the four maneuver, I am going to proceed to listening and counting for the fetal heartbeat. Okay, ma'am, I'm done with the maneuver. Now I'm going to proceed to listening for your baby's heartbeat. Okay, ma'am? To do this, I have to locate the fetal back again and then place a stethoscope over it and listen for at least 1 full minute. So as I was listening to the fetal heart tone, I also have noted for its location, rate, and character. So now I'm going to cover my patient and make her comfortable. Okay, ma'am, so we're done with the procedure and going to cover up now. So how are you feeling, ma'am? Are you comfortable?
Yes.
Okay, ma'am. So since we're done, I have determined that your baby is in acephalic presentation. This means that your baby's head is in the lower portion of your uterus and your baby's buttocks is at the upper portion of your uterus. You should know that this position is the ideal position for babies during delivery. Okay, so while listening for your baby's heartbeat, I have also counted how many times your baby's heartbeat is in 1 full minute. And I have found out that this is at 125 beats per minute. This falls within the normal range. Okay, so that's it for today, ma'am. Congratulations for your baby, and I'm going to leave now so that you can have some rest. Okay, ma'am? Do you have any more questions?
No, thank you, Miss Andrea.
So after doing the procedure, I am now going to proceed with the aftercare of the equipment that I use, and also I am going to document the findings of this procedure. In documentation, I will add the observation about the mother, how she was during the examination. And then I will include the fetal presentation, position, attitude, and whether the baby is presenting part has already been engaged or still floating. That's all.